Hey there, Fourth Trimester listeners. Our program today is proudly sponsored by Family Album, your secure haven for sharing baby photos and videos. Head over to the App Store today, search Family Album, one word, download the app, and start creating a legacy of love, one photo at a time. Hi, I'm Sarah Trott, and welcome to the Fourth Trimester Podcast. I'm a new mama, and this podcast is all about postpartum care for the first few months following birth, the time period also known as the fourth trimester. My postpartum doula, Esther Gallagher, is my co-host. She's a mother, grandmother, perinatal educator, birth and postpartum care provider. Fourth trimester care, our topic, is about the practical, emotional, and social support parents and baby require. And importantly, it helps set the tone for the continuing journey of parenting.
Hi again, listeners. It's Esther today. Sarah can't join us, sadly. She's such a busy working mom now. But I do have my wonderful guest, Adrian Villalba.
Yes.
Villalba.
There we go.
Because that's better. And he's going to talk with us today about perinatal chiropractic. But I wanted to remind you all that in addition to this podcast, which you can subscribe to and think about possibly supporting us with donations, we also have our Facebook page and our website page, fourthtrimesterpodcast.com. And there's a lot of great stuff on that page. And on the Facebook page as well, it's an opportunity to share stuff. So please check us out on those other two platforms if you get a chance. And here we are. I learned of Adrian and his practice years ago, a handful of years ago, and he has come to our doula group to talk about the form of what I like to categorize under body work, really, healing modalities, along with our guest, Leah Keller, who's also a physical therapist who works with core and pelvic floor fitness. So his work is very much integrated into the perinatal health and healing that we like to feature on our podcast whenever we get a chance. So I want to first say happy birthday to you.
Thank you. Yes.
I'm so excited that this is the day you chose to be on our podcast.
Yeah, well, what a birthday gift.
Yes, I'm happy to have you be here. And why don't you launch in, Adrian, and tell us a little bit about yourself.
Okay.
And what kind of brought you to being a perinatal chiropractor?
Great. Thank you. My name is Adrian. I started down this journey from my own health reasons, just like most people do. And I used to work for the National Park Service. And at that time, thought I was invincible. And then, some health stuff came along, and it really drove me to try to understand why I had gotten to a certain place or certain position, and then overall be able to help people never get in that spot or get out of it. Mm-hmm. And so I started my chiropractic journey going through school. And then at the end of that school, we have a clinical period. So the second half of school, we're seeing students and patients. And being a male, being a very active dude, I always thought, I'm going to be a sports chiropractor. But one of my first patients that I started to see, she was just going in for wellness, ended up becoming pregnant. And then I saw her through her whole pregnancy and then gave birth, and then a few months of her postpartum period. And that experience actually ended up being the one that gave back the most, the one I was most fulfilled with, the one that really sparked a curiosity and an interest and the passion of like, wow, this is how I want to spend my life. As a person, I have always wanted to be a father. I thought that this period in life is just, what else screams vitality more than this time period? And so being able to contribute to families' well-being and journey along this path in a positive way has always been something in the back of my mind that I feel like has guided me to where I am now.
That's a great story. And I will say, right, and I'm sure you've experienced this many times in your practice, when things aren't going along a real wellness path, it's so distressing for the people involved. And so whenever we can contribute to the whole person's well-being, everything affects everything.
Yeah.
When it's hard not to become depressed if your body is making it really, really unpleasant for you to get through what you're getting through.
Yeah.
So,
as you know, when all you can focus on is pain, you can't focus on whatever else is going on. And pregnant and new mamas, they've just got so much going on that if they're focused on their pain, then the quality of the rest of their life has to take some hits. And so in order for you to be 100% focused on baby or 100% focused on your career, whatever that might be, your relationships, those all tend to suffer if you are just focused on your body the whole time.
Right.
And so that's really where I feel like I can make a big difference, where if mom's not focused on her pain, then she can focus on baby, or she can focus on her relationships. And she's just deeply connected with what's going on and not having to get distracted.
Yeah. And it is such a thoroughly and deep physiological period of continual shifting.
Yes.
From one state to the next, to the next, to the next. And
just when you think you got it, it changes, doesn't it?
It's exactly right. And just to have support and nurturing of any sort as you ride those kind of tidal waves of change in the perinatal period. And so when we're speaking about the perinatal period, as some of you I'm no doubt know, we're talking about conception through weaning.
Yes.
Right. Yeah. Essentially. From a physiological standpoint, right? Yeah. It kind of involves the body as it moves through all those states and really, weaning, however it happens, when it happens, we kind of feel like to whatever extent the mom is now kind of back in her body as her own.
Yeah. A little bit more independent.
Yes.
Slightly.
Yeah. Yeah. And not disconnected. Of course, the social emotional continues. And of course, if your baby's weaned and your body's out of whack, it's not like you're not still in a perinatal crisis potentially. Correct. So it's all important, but that's kind of the framework of the perinatal period for us, our purposes. So let's dive in and really talk about what you do.
Yeah.
I'm so thrilled that your curiosity led you in this direction, as I think is very much the case for most of us who work in this realm. You have to be like a little extra added curious about it and not take it for granted.
Yeah.
And so, I guess as we were talking about before starting the recording, I'm just very interested in sort of the where, when, and why of all of this. And so you tell us.
Yeah. So during school, our focus is mainly the spine and the head, the body, the nerves, that kind of thing. And our main job in life as human beings is to heal. That's what our body does. And as a chiropractor, I'm constantly looking to facilitate that process. And if there's ever anything in the way of that, that's what we call a subluxation. And so we're trying to get rid of those things. And those things can come up in forms of like tension or kind of the different distribution of patterns in your body. And so when you're pregnant, then you have a whole another set of jobs. That's the only time you have another set of job. And so to be able to then connect the two nervous systems in your body now and to facilitate the healing and the growing of a baby takes on a different form. So there is extra training that I've done. I'm certified by the ICPA, which is the International Pediatric Association. And you can find their stuff on ICPA4kids.com, the number 4kids.com. And there's a good directory for anybody that has gone through that program. And they do extensive teachings on how to be clear and safe with a baby. And then I'm also Webster certified, which is what most mamas end up coming in for during their pregnancy. And they try and get away from the idea that we turn babies, because that's practicing obstetrics. There we go. Oh, that word.
Yeah.
But really what we're doing is, again, trying to facilitate the healing and the growing process, balancing out the pelvis. And when you do that, balance out all the ligaments that hold the uterus to the pelvis, then baby has the best ability and the most amount of room to put him or herself in the right position for a natural birth. And it's to facilitate whatever baby needs. And so then for postpartum, we again start with the healing process and try to facilitate that. And that's the period where you really need the most amount of support, in my opinion. So there's this weird, not philosophy, but perspective, I think, that is that I've seen, is that when you see a big belly, you know, it's this, oh my gosh, let me give you some flowers. Like, this is amazing.
Let's be really nice to that pregnant
Let's be really
lady.
nice to her. And rightfully so. When in reality, I think, at that time, mom is feeling so powerful and so amazing and feeling great. Of course, probably a little uncomfortable, but for the most part, really strong. And then once baby's born, everyone's focused on baby and kind of not forgets about mother, but mom seems to be in the back seat. And even to moms are focused on baby. Yeah. And so I know that the best thing for baby is to make sure that mom's well. Mom has to fill her own cup before she's able to feed baby, just like the airport. You have to put your own mask on first.
Yeah.
And
moms are, you know, I've said it many times on the podcast, you are in a more vulnerable state in the fourth trimester than you might be or normally would be during pregnancy in most cases.
Right.
You know, you're healing and recovering.
Yeah. And so for me, I'm constantly trying to communicate to my mamas who come pre that the work that we're going to do post birth is almost more important, because now you really need to heal to the best of your abilities. And regardless of how baby is birthed, there's going to be some tissue damage. To what extent is yet to be seen, but your body's ability to heal will be facilitated by making sure that your nervous system is clear, that the patterns of tension are distributed throughout your body so that not one tissue is overloaded, specifically the pelvic floor, and then all the deep core that's intricately connected to that. So the pelvic floor is just one grouping of muscles that is connected through muscles that go all the way down to your foot and all the way up to your head. And so if we can start work before you actually give birth to be able to connect the full line, then you're going to be decreasing the load immediately. If we can balance your hips forward and back, left and right, up and down, then you're going to be putting less load on your body in general. If you start to be able to be a little bit more sensitive as to where you're having some discomfort, or not discomfort, but dysfunction in those tension lines, then you're going to be better equipped postpartum to start the healing process and distribute those loads. So the tax brass of what I do is that I make mama feel very comfortable afterwards. You know, I create a space where she's heard, number one, and she feels connected, and then starts to help balance out the ligaments, the joints, the muscles, everything that was around the pelvis, as well as the rest of the spine. We are a very holistic practice or approach. And so we make sure that your body is firing at all cylinders, that your body is being able to tell your brain what's happening. Just like air conditioning, it's really easy to akin that to. You need to have a thermostat to know what temperature the room is at, to know whether to have more AC or more heat. And so the body works the same. The body needs to be able to tell exactly what's going on to be able to say, like, oh, I need more acid in my stomach, or I need a little bit more oxygen into my blood. And so that kind of feedback loop is constantly happening and contributes tremendously to your healing. So the better connected you are to your body, the better you're going to heal, the less you're going to be focused on your body, the more you can connect with your baby, which is, I think, ultimately what mamas really want.
Right. Absolutely. And, I mean, we all just naturally, you know, in a very, very basic, natural way, want to be, well and functioning, right?
Yeah.
Whatever our motivation into the world, inside of us, we want and perhaps need, you know, to be attached to a physical body that's as well as it can be.
Yeah.
And we tend to, I think so often, I think particularly caregivers are prone to this, wouldn't you say, Adrian? We tend to kind of forego that.
Yes.
In lieu of like what's out there that needs my attention, right? Yeah, regardless of how I feel, regardless of how I'm doing. So naturally, to whatever extent, new moms are in this place where they're compelled, right? Yeah. Deeply, deeply compelled to care for their babies, whether or not they're feeling it.
Right. Yes.
And so it can be a real, let's just say, conflict of interest in those first 3 months. And it is so naturally. I mean, this is not a social emotional judgment statement.
Yeah.
It's normal and natural to feel conflicted between, oh, if I could just sleep for 5 hours straight, I would feel so much better. Mm-hmm. And that's true. That's right. It is true. Yeah. Right. And oh, the baby's stirring and they're going to want to eat and it's going to hurt a little, and how do I pull that together? I'm so not wanting to do this right now. And yet you do it, right? You do it again and again and again. And I think it's important to acknowledge that in that very compelled state, there still is room to make good choices on your own behalf, to eat as well as possible, to sleep when your baby sleeps, whenever that is, to surround yourself with appropriate social emotional feedback, meaning people who can be appropriate in your space, and to look to your healing and recovery. Yeah. Not in that order necessarily, but certainly I think of those things as co-equal. Yeah. Right? They're all part equally of the healing and recovery that moms are going to do. Now, every mom's going to have her specific personal healing and recovery journey.
Yes.
But it sure helps to know what the resources are that are out there.
Totally.
So, Adrian, why don't you tell us a little bit about then, when would you be coming to see a new mom? Like in terms of, her healing.
Yes.
When is
so for the postpartum period, depending on when they need it, and that's different for every mom.
Okay.
So when mamas come in, and we have different like care plans and packages, and whenever they sign up for something like that, we do a complimentary home visit. And then for other moms that just need some support, we do a home visit. And depending on how the birth went, will differ on how mama might be feeling. And so we will do a home visit whenever you want. Even if you're not pregnant, we'll still come because that's the need. And so we find that mamas tend to ask for postpartum help if they've had a more traumatic birth or a birth that didn't quite go as planned. But then let's say, for instance, last week I had a mama that was totally well, and she just had this in her back pocket, which is part of why I do it, so that she knows it's there, and she just like, oh, I feel like having a little self-love. And so bring them on in. Yeah. And so other like pain points that I usually hear, breastfeeding is usually the biggest one. Yeah. So as you know, the letdown reflex is a reflex. And so that deals with your nervous system. Exactly. And so by helping the thoracic cage be mobile, be open, and be responding well, that actually helps with that. And then also in our home visits, we complimentary check the baby as well. So babies get chiropractic care as soon as they're out, if parents so choose. Like my son was 2 hours when he got his 2 hours old when he got his first chiropractic adjustment. And so that can oftentimes help with latching, which is huge. That was my wife's biggest kind of hurdle or challenge postpartum. And so I'm very empathetic on that one. I know it very intimately. And then other things, just pelvic pain. If mother did have to birth via cesarean, there's a lot of tissues there that need some help, and some other joints around the pelvis can help ease the tissues around the front half, because there's no joint right here, right below your belly where the incision happens, but everything around that, the tissues are now conform to a new position. And so that can use some help.
Well, and let me just say, having doulaed my clients through C-sections on those occasions, you're usually under anesthesia from your rib cage down.
Yeah.
You don't feel much, and your body's being manipulated from place to place. Carefully, hopefully, but not always.
Right.
As careful as your body might require. And so your body will have been through a lot before, during, and after your actual cesarean birth. And, where you get to sleep and how you get to sleep and how you're holding your body isn't normal, right? It's not, there's going to be a lot of tension in that body just because. And so it does make sense. And I was very curious to ask you about cesarean section because, of course, then after giving birth by cesarean, moms feel very limited in how they can move and where they're comfortable. They can't lie on their sides often because of the way the incision pain affects them. Right. Lying on their back is probably comfortable. Standing is probably comfortable to an extent, but it's very interesting to me, like how, because I imagine it would be really good for the healing of the lower body.
Yeah. And to your point, no matter what type of birth you have, there's going to be tissues that take some damage.
Absolutely.
And your pelvis is going to open. That's the beauty of it. But the joints get pushed a little bit beyond their normal ranges. And so to come back from that is not always going to be perfectly symmetrical, perfectly balanced. And with a big trauma like that, you constantly get inflammation. As you know, the postpartum period, there's lots of inflammation happening. And when that doesn't get circulated out like fully, it can leave some residue. And that just makes joints a little sticky. We call it just the sticky joints. And so making sure that the joints are moving well is our number one kind of tool. And then we look to the soft tissues. And when they're ever, I think one of the things that I like about our office is that we are not scared to cross-refer. We, in fact, enjoy it very much. It helps with our community. We are able to tout the fact that we have many people that know us and also that we trust to send to them. So if there's something in the tissues that I can't deal with, then I'll know who to call. I'll know who to get the help to. If I feel that they just need someone there to watch other things while they sleep, then I know who to call. If they need some more help with latching and lactation, I know who to call. And so it's not just, I'm going to be your everything. It's, I at least will know where you might use a little bit more support and who to send you to. So.
Well, we in the doula world always really appreciate that because it's the truth of the matter. I think more resources necessary, not less. And imagining that there's just one person who can do everything for you is always a mistake in life, and particularly a mistake in the postpartum period. And that doesn't mean you need a crowd around you.
Totally.
And again, I want to really appreciate you, Adrian, for being the home visiting chiropractor. I don't know how many chiropractors do that, but it's new to me. Yeah. Like you're the first I've ever heard of.
Oh, really?
Yeah. Oh, yeah. And, I say to my new moms, like, you're not leaving the house. Yeah. It's not good for you. Right. Getting in and out of the car to go to the pediatrician visit isn't a good design. They should be coming to you.
Sure.
And there are those who will.
Yeah.
So find those, right? Yeah. Getting in and out of the car to go to an obstetric follow-up visit when you're not yet healed and recovered, not a good idea.
Yeah.
Right.
And it puts more stress on you.
And it puts more stress on you. It seems like it's a way to get care, but let's really weigh and balance the kind of care you need right now. You need to be able to rest and recover. And how are you going to do that if you're sitting in an office waiting for somebody to see you?
Totally.
So,
and on the flip side,
I'm kind of particular about these things, but I'm also in a position to see how moms are doing,
right?
And help them make a good decision.
Totally.
And because I'm there in the first 2 weeks,
boots on the floor, or whatever.
And so otherwise they wouldn't know. They would just say, "Oh, yeah, I guess I have to go because I've been told."
Totally. And on the flip side, I do want to mention that it's not that I don't want mamas to move. There are a lot of things that you can do at home that are, the word exercise, I feel like is a little extreme, but movement and breathing, there's a way to encourage your body to, or support your body in the healing process where movement is involved. And so hopefully none of those like words trigger you to where you're like, no, I'm not going to do it. But there are things that you can do for yourself. And we teach that to our moms beforehand. And then we have videos that help mom afterwards as well.
Which is awesome because after all, once she's given birth, she still has to eat and get up to pee and poop and sit in different positions to breastfeed or lie down to breastfeed. And all of those things are having an effect. So how you get out of bed, how you get to the bathroom, how you walk around the apartment to feel your body in motion and help it, circulate.
How you hold baby.
How you hold baby.
You take baby up and down from the crib.
Yes. Oh my gosh.
How do you hold a car seat?
I see. Let's things. Not. I'm like the one who says, don't carry that car seat with a baby in it. Carry the baby.
Or I think you have your partners there.
Yeah, right. Exactly. Have a way to carry the baby to and from and leave the car seat in the car.
Yeah.
As far as I'm concerned, things shouldn't move with a baby in it, except if it's in a car.
Yeah.
But that's my opinion. Sure. And I think learning how to do these things appropriately, if and when you're going to be doing them, is so important.
Yeah.
I mean, lifting and twisting is the way most people throw themselves out of whack, right? That's how it happens.
That's very true.
Most of the time. And that's exactly what the car seat manufacturers are asking you to do.
Yeah.
Lift a thing and then twist to get it out of the car. Don't do that. Back up.
Right. Yeah.
Hey, fellow parents, can we take a moment to reflect on the joyous chaos that is parenthood? You know those days when our hearts swell with love at the sight of our little ones and we're bursting at the seams to share every adorable moment with the world. But let's be real. Some things are better kept in the family, and your loved ones who matter the most aren't always close by, and they might not be that tech-savvy either. So how can you easily share your baby's beautiful growth with loved ones while keeping your precious memories secure? I remember the frustration of trying to use some of the big tech photo solutions, only to find they fell short of what I needed. That's when I stumbled upon something truly remarkable, the Family Album app. The Family Album app was created to give parents a secure and easy way to share photos and videos with loved ones. It's an orderly and totally secure haven for your family's personal memories. I love that there's no third-party ads, no unwanted eyes, unlimited storage, and that it's totally free. So to all the parents who are out there still trying to use other messaging apps for your kids' photos, it's time to level up your family photo game with a free photo sharing app. Head over to the App Store today, search Family Album, one word, download the app, and start creating a legacy of love one photo at a time.
I have a lot of little snippets on my Instagram page, and we have videos at our office of how, if you have to carry the car seat, because a lot of people do, how to do it to the best of your ability.
Yeah.
And on that note, like how to move as a parent. So I have this series called Mama Movement, which is it's for papas too, but it's a designed movement patterning of picking stuff up from the floor. Like I was saying, picking the baby up from the floor or putting him or her down in their crib. The high chair is a big one if you're later in the postpartum time, because my baby right now is almost 20 pounds now, and that's a big wiggling kettlebell. And even if I'm not in my gym clothes, I still have to remember that this is a weight that is putting stress and forces into my body. So if I can act with proper form, and that becomes second nature when I don't have to think about it, then my body can get stronger from these movements versus getting broken down.
Yeah.
And so you see a lot of mamas and dads hold the baby out with the hips all out of whack.
I did it.
Back. Yeah.
I did it for minimum of 6 years of my life doing babies. Yeah.
And then now you're a postpartum doula, so you're still around babies all the time. And so the way in which you hold yourself is going to be very important. And so for parents that have never done it before, there is this whole, you got it, it's natural. This is fine. And it doesn't hurt right now.
Well, let me just tell you folks, someday you're going to be my age. I'm about to be 60. And it will come back.
Yeah. So
totally comes back to haunt you.
There are a few things that you can do that will help you stay a little bit safer. And in the end, be able to do the things that you want to do for longer. Yeah.
And let me just say, I had my first at 18. I was in a different body than most of my clients who are pushing 40 or more when they're having their first kids. So all the more reason why we really need to be well informed and in a good practice of body awareness.
Totally.
You know?
And you hit it earlier on the head. I was going to say, our 4 pillars in our office, what we tout is to be able to eat, move, think, and recuperate better. Those are the 4 pillars of health, in our opinion, and in most big kind of philosophies. And so if we can support those 4 things in general, you're going to be increasing your resilience to stress. And that's our big, we'd like it to be our big tagline, because we're not going to de-stress your life, especially as a new parent. As soon as baby goes to bed, you might have a pause for a minute or 2, but baby gets back up, baby starts to scream, and the stress goes right back up. So if we can just increase your resilience to that stress, where your threshold isn't quite so low, and little stresses in life as they come, they don't cross that threshold, then you're going to be experiencing less symptoms, pain, diseases, whatever that might be.
And potentially more joy, which would be nice, right?
Yeah. So like it's all features, right? We do this, we do that, but the benefits of not crossing that threshold are unquantifiable. The connection with your baby, your ability to just let things roll off your shoulders when they could be annoying at some point. They could also be funny. You can laugh a little bit more. You can connect and then be more creative in the way that you respond. And
your brain can release more oxytocin.
Exactly. Which, man, I'd like some more
powerful
of that.
Stuff.
Exactly.
Right?
Yeah. So our ability to increase the resilience to stress comes from those 4 pillars, like you were saying. And you can just do little tiny things to increase those things. Like you said, making better decisions, small decisions in the end is life-changing.
Yeah. So we're going to wrap up here pretty soon. And I feel like, we talked about the 3 big questions and more. But I want to circle back to the when a little bit and talk a little more about that, because I think, on the one hand, if new moms having just given birth sometime in the first 24 hours could get a nice adjustment and or a massage, wouldn't that be great?
It'd be fantastic.
Wouldn't that be fantastic? Yeah. But I will also say, from both the mother and the doula experience and perspective, most of us just don't want somebody showing up who isn't, part of the family, so to speak. Often if we've delivered in the hospital, which far too many people do, in my opinion.
Sure.
But in any case, there's just too much going on around you as it is.
Right.
Doesn't mean that the best thing to happen wouldn't be your visit from the chiropractor. But, and then, day 3, there's this big hormone shift. Most moms are feeling their vulnerability has it really hit them on day 3. The endorphins have worn off. Breastfeeding is starting to hit harder. The recognition of what it all is about and what you're experiencing with it. And that's also, if you've delivered in the hospital, that's the day they push you out of the nest and send you off, and it's quite disruptive. Yeah. So given that sort of first 3 days trajectory, and sometimes it's 4 and 5 if you've had a C-section, and then you're home and there's some relief in that, but then there's also the existential crisis of, oh my God, here we are with a baby all along.
I remember it very well.
Yes, of course you do. Is there, I'm imagining, if you haven't gotten around to it, if you just couldn't have integrated it between day 1 and day 7, that day 7 might be the point at which you could imagine, okay, my body's starting to settle in to whatever is, but I don't want to go off the rails, and it would be good to have some therapeutic body work.
Sure.
What do you think of sort of that as a number? It's, it's arbitrary, but
right. So far, obviously with my wife, I was able to be there hours afterwards. Yeah. And with my business partner's wife as well. The big thing for me is listening and making sure that mom feels comfortable with me. I'm a man, and so sometimes that could be
Yeah, she
usually,
doesn't want to have to
not.
get out of her jammies.
Exactly.
For this, right?
Yeah, usually not. And that's why it has helped having a previous relationship with me. So most clients, the earlier that I see in postpartum have been clients that have already seen me before.
Mm-hmm.
But it's usually, like you mentioned, around day 7 to 14. It's in that second week.
Mm-hmm.
But it's just whenever you're ready, you know, and the earlier, for me, ideally, the better. But I don't want my visit to stress you out more than the benefits that you get. That's the ultimate balancing point. I think what I'm going to provide is definitely going to be a good thing for you. The only thing I can guarantee is that people are going to be healing better after I see them. Mm-hmm. But again, there's so much going on. You're acutely aware of baby in those first couple days, and that's where your focus is. So if someone coming over to your house is stressing you out more than the benefits, then I say, let's give it a couple days. Mm-hmm. But ideally, the first 2 weeks, just to make sure that when you're healing and you're coming back into your own body, that it's balanced, that it's straight, that everything is distributed. The tensions are distributed throughout as many tissues as possible, to not overload one particular spot. But then it's really up to you. And then after that, you'll start to feel better, and then you'll be able to decide when you want your next visit. Mm-hmm. But usually within the first 2 weeks is ideal, but whenever's comfortable.
Mm-hmm. Yeah. Well, certainly looking back, I could have done with, on my own behalf, any kind of body work. Mm-hmm. You know, it's a thing that I didn't get postpartum and didn't feel I could afford, didn't know it was available necessarily. Right. Yeah. And I think just, helping all of that tissue come back into relationship with itself is a big thing and would have been eminently helpful to me. And I had easy births, Adrian. It wasn't because I had these difficult births that tore me apart. No, it wasn't that at all. It was, now I was doing the work of being a mother. Yeah. And it's hard work when the baby's on the outside. Right. And, living in sort of suboptimal conditions on every level. But I think
because there are easy births doesn't mean that it wasn't the most.
I was still postpartum.
Exactly.
There all the way in postpartum.
Birth is the most physical and emotional event of your life. And so you're going to have traumas from that, and the word trauma might be extreme for some people, but just the physiological sense of tissues will be stretched beyond their capacity for a bit. And so you will be healing, and that's your main job. And so the easier,
and you're healing while having to do the hard work.
Yes.
It's, let's not, I repeat it again and again and again, right? Like, let's not forget that, you don't get to just, I've been lucky with my back injury. I can just lay around my apartment if I want to. Yeah. I don't. Yeah. But I'm aware of the need to rest and recover, and there's nothing impeding that currently. Yeah. So that's not the case when you're postpartum. Right. Right. Yeah. So it's all the more reason to, bring in those modalities that are going to really serve your recovery, whatever those to be. Yeah. Reach out. Yeah. Adrian, this has been lovely.
Yes,
thanks so much for stopping by my little apartment and talking to us about all this great stuff. Yeah. And we will post notes and on the website about your visit and, of course, your recording. Yeah. You're going to probably find ways to put it out into the world even further, which is wonderful. And we may have occasion to want to have you back.
Yeah, thanks. I'd love to come back.
Maybe we'll talk about chiropractic for dads next time.
Yes.
That be good?
Yeah, we are often overlooked.
Yes, absolutely. I agree. Okay. Well, everybody, it was wonderful recording on your behalf today. Circle around and look at our other platforms. And if you can help support us, that would be well received. And hope you have a great, great day and are getting healthy and happy and enjoying life. Take care.
You can subscribe to this podcast in order to hear more from us. Thank you for listening, everyone, and I hope you'll join us next time on the Fourth Trimester. The theme music on this podcast was created by Sean Trott. Hear more at soundcloud.com/Sean Trott. Special thanks to my true loves, my husband Ben, daughter Penelope, and baby girl Evelyn. Don't forget to share the Fourth Trimester Podcast with any new and expecting parents. I'm Sarah Trott. Goodbye for now.
Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I'll sing a song for you. You got your wheels, you got your gears. You ride around town without any fear. You got your pedals, you got your brakes. You always wear your helmet for safety's sake. Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you. Hello again, bicycle man. I know you're doing the best that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you.